Good evening, everyone, and welcome to tonight's webinar, Supporting Aged Care Residents with Chronic Conditions and Complex Care During COVID-19. My name is Kiara Beans, and on behalf of GPEx and Country Say PHN, I'm excited to offer this three-part webinar series with Jane Calligeros. Jane is the owner and lead consultant at CDM Plus, whom provide training and resources for primary healthcare, community and aged care. Jane has an extensive background in nursing, has been working in general practice for the past 7 years and holds postgraduate qualifications in chronic disease management. I would like to acknowledge that we are hosting this webinar from the lands of the traditional custodians. I acknowledge the traditional custodians of the various lands on which you will work today and the Aboriginal and Torres Strait Islander people participating in this webinar. We will have a 5-minute Q&A session at the end of Jane's presentation. However, please feel free to utilise the chat option at the bottom of your screen throughout the webinar, and Jane and I will endeavour to get to you all. Thank you, and over to you, Jane.
Hi, how you going? I'm just going to click through. So good evening and welcome to the first webinar looking at the temporary MBS items for GPs and other medical practitioners to support the aged care residents with chronic conditions and complex care during COVID-19. So tonight we're going to look at the impact that COVID-19 has had on aged care and the current initiatives that are now available to better support residents and the providers. So there's a lot of reports that have kind of brought us to where we are now with these additional services. So I thought it was kind of appropriate that we look at a bit at that tonight. So a couple of those reports that we're going to look at to kind of put it into context of why these additional services have come about. So I guess COVID-19 has had many impacts on Australians over the last 12 months or more, especially in the delivery of health services. So there's been a number of challenges that have faced aged care providers and residents during the pandemic. So a couple of those reports we're going to look at that have led to the changes now available include the Royal Commission into Aged Care Quality and Safety. So we're going to look at some of those outcomes from that final report. Aged Care and COVID-19, the special report that came out around that and the progress against those recommendations. And we're also going to look at the National COVID Aged Care Plan and the impacts of that as well. So we've got links to all of those reports that we're going to go through as well, and some of them aren't too long if you're not a fan of the reports, but we're going to look at those in some detail just to put it into context. So the Royal Commission into Aged Care and Quality and Safety was established in 2018 by the Australian government. So this special report was on COVID-19 pandemic in aged care was handed in October 2020. So the report's a result of the hearing of the Royal Commission into Aged Care that happened in August. And there was a number of events leading up to this as well. So to put it into context, that Royal Commission started in 2018. And then during that lead up to the declaration of a pandemic by WHO in March 2020 kind of took us to that point. So those hearings were in August, and then we've got that report that came out in October following that. So it's just kind of that lead up into kind of where we are now. So the report outlines the recommendations to ensure the physical and mental wellbeing for residents. And if it's one of the smaller reports as well, and I highly recommend reading it, it kind of outlines a lot of what we're going to talk about and the outcomes of those reports. It looks at a lot of the background that led into that inquiry as well, and that's not for us to go into tonight, but it's just to reference back to it, and I do recommend having a read of that. So from that report, those 6 recommendations that came out followed another report which kind of outlined the progress against those 6 recommendations that the Royal Commission did with that special report. So if you're going to read them in order, I'd start with that one first. So the first one we just looked at, and then you can just read it against this. So we're actually just going to look at those 6 recommendations and what actually was the progress against that. So just the summary of where we're kind of at the moment. So when we go through, so the recommendation, the first one was that the Australian government should report to Parliament by no later than the 1st of December on the implementation of those recommendations. That was done November 2020. The second recommendation was that the Australian government should immediately fund providers that apply for funding to ensure that adequate staff are available to allow the continued visits to people living in residential aged care by their family and friends. So that recommendation was accepted by the Australian government, and they have delivered 450 million through 2 separate payments. These went to residential aged care providers to support the preparedness and response to COVID, including the visitation to aged care facilities by family and friends for the residents. So the key measures against that second recommendation, I was just going to give you a little bit more info about that. So it's just broken down into those 4 points. So the key measures were that the COVID-19 support payments for residential aged care providers. So in August, the government had committed to 217.6 million as part of that initial 245 million to support the providers. They received that payment back in October 2020. So this builds on those 3 first COVID supplements announced back in May, and that the providers received in the following June. So the second point was around the increased advocacy support, and the government provided 4 million to that in additional funding as well. The third one was around older persons COVID-19 support line, and the government in November added an additional 2.5 million to that investment as well. The fourth one on there was around the supporting the visitation for Victorian residential aged care, and that was back in July. So the next recommendation, so recommendation 3 was that the Australian government should urgently create Medicare benefit schedule items to increase the provision of allied health services. That also included mental health services to people in aged care during the pandemic. It also outlined that any barriers, whether real or perceived, to allied health professionals being able to enter residential aged care facilities should be removed unless justified or on the genuine public health grounds. So the government accepted that recommendation, and that's where a lot of those item numbers that we're going to talk about a little bit later and over the next 2 webinars that we'll be delivering that are going to cover. So the cost of adding those additional items, or the 2 new MBS items in this part of it, was 47.6 million for mental health and allied health services for aged care facility residents. So in addition to the measures recommended by the Commission, the Australian government also provided 15.7 million for the primary health networks as well, to provide in-reach group reablement programs as well. So against that third recommendation were new measures as well. So as I said, the mental health services that I just mentioned, we're actually going to look at in session 2. So this webinar is the first of three in the series. So the second session, we're actually going to look at the mental health services and how that's supporting the residents during COVID, and then the allied health services as well, that we'll look at in session 3, and how that's supporting residents during COVID. So by increasing access to mental health, and we're going to touch on that in that second session, so I'm not going to get into it too much tonight. We're looking at how they've expanded the better access to psychiatrists, psychologists and general practitioners through the MBS initiative, the Better Access Program. So that will allow aged care residents up to 20 individual psychological therapy sessions through $35 million worth of funding through those items. And then with the allied health services, by increasing those services for residents, we're hoping to improve access for patients, for residents, and the incentives to the allied health professionals to actually deliver the services. So the hope is that all of these measures combined are going to help to improve residents' physical and mental health, to address deconditioning caused by isolation, and to provide some support and a more structured approach to treat the mental disorders. So the measures provide additional mental and physical therapies by allied health professionals, including the psychologists, social workers, OTs, physios and EPs. And we'll look at that in that third session as well in the context of allied health. The fourth recommendation was that the Australian Government should establish a national aged care plan for COVID-19. This was updated, endorsed like on the 13th of November and published on the website as well. And we'll look at that in a little bit as well during this session. So the fifth recommendation was that all residential aged care homes should have one or more trained infection control officers as a condition of their accreditation. So the training requirements for these officers should be set by the aged care advisory body that was proposed by the commissioners. The Australian Government did accept that recommendation and provided funding the $217.6 million in October last year. So that was to be used for part of that preparedness and response, including the cost of engaging the infection officers. Now, the sixth recommendation was that the Australian Government should arrange with the states and territories to deploy accredited infection prevention and control experts into residential aged care homes to provide training, assist with the preparation of outbreak management plans and assist with outbreaks. So the Australian Government will increase its contribution, and so that's gone from 50 to 100% for activity by the states to support that. And the Commonwealth's working collaboratively with the states and territory to ensure the delivery of that as well. One of the almost last reports, so it's like the third out of the 4 that we'll talk about tonight, and that's the National COVID-19 Aged Care Plan. So the link will take you straight through to that report. The context that we're going to look at it tonight is more around the COVID-19 related deconditioning of older people. So evidence like it emerged from COVID-19 experience that older people that can't access like the regular health services, whether it was in aged care facilities, home care, were choosing not to access services in order to minimise the risk of exposure to COVID-19, and those that were transferred from aged cares to hospitals. And obviously the outcome was worse clinical outcomes for those patients and residents. So there's 3 main factors contributing to deconditioning. This includes psychological, nutritional and physical. So part of the new services that have come about are to actually address the deconditioning. So a lot of this additional access to allied health services will reflect what we're going to go through now in this report as well. So allied health has a really big role in the prevention of decline, as much as they do in the rehabilitation for residents as well. For Aboriginal and Torres Strait Islander people, the holistic view of health also includes spiritual, social and emotional wellbeing for the provision of the culturally safe care and focusing on delivering that person-centred care for residents. So a lot of this is outlined in that report, as well as like emergency response, etc. So if you haven't had a chance to have a look at this report, or the aged care plan, I think it's worth a read. It's a little bit longer than the other reports, but yeah, definitely worth it. So that link will take you straight through to that one as well. The next part of this webinar, we're actually just going to look at aged care and in the context of that Royal Commission Quality Report. So I guess, as we all know, like aged care isn't just one service. It's there to help support older people that need help in their own home, and it can include services that are also in residential or home supported programs as well. So how many Australians are affected or receive some form of aged care? There's over 1.3 million people in Australia that receive some form of aged care. So in one of those reports that we had, something like 783,000 people were receiving like a home support program or home support through the Commonwealth supported programs. Some of the other stats that we've got there, over 64,000 people received support through the program in WA. Over 100,000 people received care through a home care package. Over 61,000 received residential respite, and then 33,000 of those, just over, were also later admitted. And then there's over 240,000 people receive permanent residential aged care. So I think those stats were 18, 19, so they'd be a little bit more by now. So what are the different types of aged care services? So some of those services include care in a patient's home, residential aged care, which is a lot what we're talking about in context with the allied health support that's being provided. And then we've also got short-term care, so things like after hospital and respite care. And the Australian government also subsidises most of the types of aged care for people that are eligible. I've got links to those different programs there as well if you want to have a look. The next part of, just wanted to touch on the Royal Commission and where it kind of sits in all of this as well. So as we said, that Royal Commission report started back in 2018, like the actual inquiry. It was set up to look at the quality of services. So it included care for old people living at home, people with dementia, and then people living in residential care. So that also included the younger people with disabilities. So the Royal Commission, if you haven't been onto the website, it's a really great website. It's got everything from all the reports, there's contacts, frequently asked questions. So the Commission was like a public inquiry. The Commission it was different from other inquiries, so it just has the power to summon witnesses, and all of those things actually outlined in some of those volumes of reports as well. So you can actually order hard copy. I ordered my own hard copy version of the report as well. You can read it online. It just outlines all of their findings and hearings, etc. So the first 3 volumes are probably the most, I guess, summarise like everything where we are at the moment. So I was just going to talk a little bit about those 3. The subsequent reports also have things like the hearing and testimonies, etc., and then further references. So the first volume that we've got there provides the background of how the Commission's inquiry came about, how it was conducted, and presents like a summary of that final report and lists all the recommendations made. So if you're only going to read one, I'd suggest like that volume 1 will kind of bring you up to speed of where everything kind of finished in those recommendations. The second volume looked at the current aged care system, the problems of access, and the nature and extent of the substandard care and other systemic problems. So just one of the things, Commissioner Briggs concluded that at least 1 in 3 people that were accessing residential aged care and home care services, over 30% of those had experienced substandard care. So that was a really good one to actually look at how disjointed, I guess, some of the aged care services are, and from that perspective of residents and patients as well. So it was a really really well written, and I do recommend reading at least those that first volume, if not the first 3. Volume 3 ended up being 2 separate volumes, so it actually outlines the new system for aged care and addresses things like access, governance, financing, the workforce, Aboriginal and Torres Strait Islander people, regional, rural and remote Australia, disability, younger people in aged care, and a little bit more as well. So I think it was a really well written part of the report as well, and I think it's definitely worth a read to just see what some of those new ideas were, and tax items, etc. So the next part of what we're going to go through now is just some of those MBS items. So there's a lot of fact sheets, and due to everything that's happened with COVID, there's been so many updates with Medicare and so many fact sheets, etc. It can all become a little bit confusing. So this session, we're going to look at just those temporary MBS items for the GPs and other medical practitioners. And then in the subsequent sessions, we'll talk about the MBS items in relation to mental health as well. And then the third session, we'll look at the allied health numbers as well. So just tried to break down all of that content because it's a bit overwhelming, I think, in one go. So for the GPs and other medical practitioners, we've also got some resources as well. And we'll have a look at that towards the end of the session. So I guess if you've had a read of those basic fact sheets that came out around December, if you haven't had a look yet, you can access those straight from the MBS website. But from December 2020 up until June next year, we're up to, so June 2022, those MBS items that will be available for residential aged care facilities for the residents, to support the mental and physical health of aged care residents that have been affected by the COVID pandemic, and all the measures taken to contain the spread. So these numbers are to, recognise that additional effort for providers travelling to the aged care facilities, etc., and providing the services to their patients. So as we already mentioned, many of the people in residential aged care have experienced deconditioning because of the COVID-19 pandemic. So as we mentioned, as part of that National Care Report as well, that deconditioning, it's quite complex, the physiological change following that period of inactivity and bed rest. So increasing the access to allied health services in person and remotely via telehealth will hopefully help patients maintain and improve their health and wellbeing. So if you haven't had a chance to have a look at those fact sheets, I recommend having a look, and we've also got links to those as well. So this is straight from one of those fact sheets from MBS. So it's for the services, so GPs and other medical practitioner services are also eligible for a call out or that flag 4 fee, expanded to these additional numbers. So for the contributions to the Multidisciplinary Care Plan and for the Aboriginal and Torres Strait Islander health assessments. So these additional items will allow the care recipients in the aged care facility to actually increase the amount of selected Medicare subsidised chronic disease management plan allied health services and enable them access to allied health group services. So I guess the main highlight is that you don't need a brand new referral form. I think that was the most exciting bit, because it will all come down to paperwork and it can get a bit confusing. So the new MBS items for the care recipients in a residential aged care facility will also replicate the existing face-to-face and telehealth items for the allied health chronic disease management plan services, Indigenous follow-up services for eligible patients that have received a health assessment, and group assessment services. Now, in the next 2 sessions, we're going to break that down a little bit more into some other resources that you can kind of access as well. But I definitely recommend looking at that fact sheet from tonight because it will actually just show you the breakdown in those services. And then there's also one for the mental health and allied health. So there's also going to be new temporary residential aged care facility MBS items that allow access up to those 10 services. So that's for selected physical therapy services, including exercise physiology, occupational therapy, and physiotherapy. So in addition to those temporary face-to-face, there's also the initial individual allied health. So these are all for the allied health as those additional services. And then we're going to look at the ones for the GPs and other medical practitioners. So the 4 new item numbers for the GPs, I'll actually show you on the new table, actually, that might be easier. So this one here, so for the GPs, we've actually got the 731 and the new temporary number for the face-to-face is that 93469. So it's professional attendance by GP at a residential aged care facility to prepare or amend a care plan. And then we've also got the existing 715. The new temporary item that's there is the 93470. So that's to perform a health assessment for a resident of Aboriginal and Torres Strait Islander descent. So that's broken up in a table there as well, and the link will take you through to that fact sheet and item number as well. And then I've also got the slide there for other medical practitioners and the existing item numbers versus the new face-to-face temporary numbers there. So same one, it's for the contribution or review of the care plan or for the health assessment for the Aboriginal and Torres Strait Islander residents. I thought I would just include just a little snip of those referral forms. So to provide the incentives for the allied health professionals to deliver those services, those patients that already have an existing referral form won't need a new one. It will just be when you actually do that review, you just need to make sure that it's been added into their existing plan. So it will actually allow the increase of the services from 5 to the maximum of 10. for those residents. And we'll look at that more in session 3. And that the flag fall item is also added to those GP numbers as well as their face-to-face visits. So where those temporary additional services are actually already included in that patient's eligible treatment, management or care plan, medical practitioners aren't required to provide an additional referral. And that's what I was just mentioning before. So I thought that was the highlight, that we didn't need an additional form, but it's great that we get, that the residents actually get access to these additional services. So if an updated treatment, management or care plan is required, then those same services in the calendar year, and those additional services for physiotherapy, exercise physiology and occupational health services. So no new referrals required for any of those, as long as it's documented in that patient in the resident plan. Just on the next one, so the next form is just that allied health referral form as well. So these new arrangements, and the reason we have that secondary temporary number for that 715 health assessment as well, is that those new arrangements are also replicated for the Aboriginal and Torres Strait Islander patients in the residential aged care facility as well, that are eligible for the allied health services. So it would be under that secondary form as well. So that new item number for the GPs was that 93470 for that health assessment. I'm just going to show you, we've actually got some resources, and I can share the bigger screen if that will help as well. But we've got some free resources that can actually be accessed up until June next year. So if you do have residents that you're visiting in the aged care facility, we have actually just kind of broken down the GP numbers. There's also a separate billing sheet available for the other medical practitioners as well. And it just has all those items. So you can see on the left side that we've got the face-to-face. In the middle column there, we've got the telehealth numbers, and then the phone numbers there as well, and then the flag fall as well. So it just makes it that little bit easier if you're unsure of some of those items. So the GP and other medical practitioners billing sheets that we've got available there, it's just accessible from the CDM Plus website in that online module section. You can just click in there and register for free. And in those billing sheets, it's going to actually look at some of those items that we're actually going to look at in the next session. So the next session is the mental health support. So it is for the GP, other medical practitioners and other mental health providers. So the GP numbers are here for the aged care facility mental health treatment plans, as well as those initial and additional focused psychological sessions as well. So it's a great resource if you need a chance to. You can just download as a PDF and then take that with you. We recognise that, like, all these additional services are great, but we recognise that it is hard with GP shortages and allied health shortages pretty much around Australia, from what we keep hearing from clinics and things that we're working with. So anything that can just help make that little bit easier. So you've got the option. I think these slides are going to be provided as a PDF as well, so it makes it easier to kind of click into those links. So you can visit the website to access those resources, And at the moment, there's the GP and the other medical practitioner. After the next session, the mental health providers, so for the psychologists, etc., there will be a billing sheet for them as well. And then there's also billing sheets available for the allied health providers after their session. So you can scan the code or just visit the website. Now, a couple of those other resources that we've got, I've listed all of those reports and any references as well, just listed in links at the back of the slides. And it goes through everything from those special reports and the COVID report, the Royal Commission final report as well, all the way through to that national plan, and then just down through to some of those Medicare links as well to the fact sheets. So I think I finished on time, if not a little bit earlier for the first time ever. So there's time for some questions or...
Thanks, Jane.